adequately palpate the areas that you need to. First, we're going to check the PMI. And note that there are no abnormal pulsations, lifts, heaves, or thrills. Next, we're going to also take the heart in the different areas of assessment. We are going to start with the aortic area in the second right intercostal space at the sternal border. And it is normal. Then we will move on to the pulmonic area in the second intercostal space on the left at the sternal border. Nice strong pulse there. We will move on to the Erb's point, the third left intercostal space at the sternal border. Nice strong pulse there with no abnormalities. Then we will assess the tricuspid, the fourth intercostal space. And it is normal. And then the mitral, the fifth left intercostal space at the mid-clavicular line. And she does have a good strong pulse there with no abnormalities or bruise noted. We would then listen to her apical heart rate for 1 full minute. And with this patient, she has no abnormalities in her heart rate, no bruise are noted, no adventitious sounds are there. Next, we're going to move on to her abdomen. Okay. First, we will inspect her abdomen, do a skin assessment. Allery has no abnormalities here, no masses or anything that we might find. We are going to also check for contour, pulsations, or movement. She is symmetrical in her abdomen. There's no swelling noted, no pulsations noted. If you will uncross your legs for me. Then we will also take the abdomen, listen for vowel sounds in all 4 quadrants. And she does have good hyperactive vowel sounds noted. Next, we will listen for any bruise in the aorta, the renal arteries, and the femoral arteries. And again, in the interest of Mallory's privacy, we would normally have the patient in just their underwear, but for Mallory's purposes, we chose to leave her clothes on for this assessment. Okay. She did not have any bruise noted. Next, we're going to take a look at all 4 quadrants in percuss for tympany or any dullness. And all 4 areas are equal. Next, we're going to do some light palpation on the abdomen in all 4 quadrants. Any pain when I do this? Okay. Once we have done our light palpation, we'll move on to deep palpation. Any pain when I do this? Okay. Once we've done that, we're going to check for rebound tenderness. I'm going to push down, and when I let go, if you feel any pain, let me know. None at all. Okay. Next, we're going to look at the midline for any aortic pulsations. Things are normal with this patient. And then we will check the femoral pulse just to make sure it is good and strong. She does have a strong femoral pulse. Next, we're going to do a hernia assessment on this patient. Mallory, what I'm going to have you do is if you can kind of raise your feet just a little bit there. And I want you to kind of try to sit up on your own. I'm just going to take a look at your belly. Okay, no hernia is noted. Thank you. Next one, we'll move on to her lower extremities. We are going to do a skin assessment bilaterally. With this patient, she does still have her pants on. So what we would do is check for the skin. We can note that we checked her skin assessment prior to the video and there were no abnormalities noted. We are going to palpate for her different pulses, the pedal pulses, as well as the posterior tibial. And her capillary refill is normal. Her pulses are equal and strong. There is no edema noted over the bony prominences in her lower extremities. Everything looks good there. Next, we're going to check a Holman sign. What I'm going to do is flex your foot up. Any pain? Okay. No pain in the calves are noted. Okay. Next, we will move on to our cranial nerve assessment. The first thing we're going to check is our olfactory nerve. I'm going to have you sit up for me. What we would do with the olfactory nerve is we would check both sides to determine if the patient could smell adequately both sides. Because we did this in our head assessment, we do not need to repeat it at this time. Next, we're going to check the optic nerves. We will use a pin light to determine if the eyes move equally. I want you to follow this pin light for me. We're going to use a wagon wheel pattern. Good, and she had no trouble with that. Next, we're going to check the 3rd, 4th, and 6th cranial nerves. We did just check our cardinal fields of gaze, excuse